Kuwait, in our constitution, the public health is Article number 15, which provides the facilities for the population living in the country. And basically, it is free. There are other issues, which is the education, which is also free in the country. Now, having said that, we have very unique example of the health system in the country, because we have a general hospitals for each governorate of Kuwait, and we have close to over 94 primary health cares, which are divided between these hospitals. So they report to these hospitals. And in addition to these, there are many specialized hospitals, which are specially built for cancer and for many other diseases, which is concentrate specifically on those diseases in the country. Communicable diseases in Kuwait is very little compared to what used to be a long time ago. Vaccination is done, a lot of prevention is done. But the chronic diseases is the one which is actually going to be more and more in the country, including diabetes. And the problem with the diabetes is a disease or a health condition that you have no feeling for it for a long time. So it's the type 1 and type 2 diabetes. But basically, you don't feel it. Apart from type 1 diabetes, that you really need insulin from the beginning of your life. Type 2 is the adult onset, and it is later on in your life which you will have it. But unfortunately, in the recent years, not only in Kuwait, in many countries around the world, this type 2 diabetes from adult onset, which is certain age group, elderly, has come down to the younger age group. And it's more or less relates to, apart from the genetic part of it, but it really relates to the lifestyle and the amount of food you take and the type of food you take, the exercise that you don't do, and the sweet we always have in Kuwait. Now, having said that, at the same time, this institute was built in relation to a survey which was made for a long time ago, about 8 years ago, where 150 physicians identified the future need for Kuwait is to concentrate on diabetes. That's basically the beginning of it. And it was built at the time of His Highness late Sheikh Jaber al-Sabah, and it was opened on 6/6/2006 by His present Highness of Kuwait, which is Sheikh Sabah al-Ahmad. I have been here for 2 years and 5 months now, and I have looked at the evaluation of which was made in order to what to do in the future, the planning which we are put together with my colleagues from outside Kuwait and inside Kuwait in order what to do. Because diabetes is especially relates to 2 factors of the type 2 diabetes. One is the lifestyle, as I mentioned, and the other one is the food and the quantity and the quality of the food that you are absorbing every day. And really it relates to the calories that you have every day. What is needed to look at is how to make a difference in the future or now in order to make sure the lifestyle of the population is changed. Unfortunately, between the diabetes, which is part of it, the other part, which is the problem, is the obesity. So we have 47% of the population is obese. And that is not, obesity alone, you can lose 9 years of your life. Obesity and diabetes, you can lose 15 years of your life. And if with that combination together, I would be and diabetes type 2 coming to less than 10 years of age, in the Kuwaiti population. The concern is what we should do now in order to make sure the people will not have shorter lifespan, and as well as to make sure that they will be living healthy rather than living shorter but also not healthy. We have not seen yet the impact of this on the health system in Kuwait, and we have not even calculated how much it would cost, not only the people, but also the government of the Kuwait who provide the health system free. We are doing a study on this one to make a recommendation which is knowledge-based information to the government.